Hello, I'm Dr. Brannick Riggs. I'm Vice President of Clinical Initiatives here at doTERRA, and I have with me today an amazing panel I'd like to introduce you to. We have Dr. Jessica Herzog, who is a pediatrician by training, now is a functional medicine physician with a functional medicine integrative practice in Utah, and is a member of our medical advisory board. Dr. Catherine Iga Phillips, the newest member of doTERRA's medical advisory board, is a family practice doctor who has an established integrative medical center in Atlanta, Georgia. Dr. Amy Carmichael, receiving her training in the UK and then moved to Australia, where she now is a functional medicine doctor there. Dr. Tad Geiger is an anesthesiologist, is part of our medical advisory board, and has extensive background in essential oils, having studied them and used them for almost 2 decades. Jackie Isles is a nurse who specializes in health retreat management and has a background in oncology, community care, and palliative care. Today, we'd like to talk about some of the challenges that have been facing us globally over the last few years, but also probably individually as well, as these topics that we're discussing today impacts each of us, our family members, and our friends. It's estimated that 1 in 5, almost 20% of the population, has experienced some common mental health disorders in the previous 12 months. Of these, anxiety disorder is the most prevalent, affecting 1 in 7. And although these numbers have been probably underestimated of their true scale due to the underreporting of cases, I want to point out, though, that beyond mental health disorders, we all experience the highs and lows of life. Life is often messy, with days of beautiful sunshine and then days of significant challenge. What we as a society have experienced over the last year has helped us understand that we are all vulnerable to mood variability. Dr. Carmichael and Jackie, how have the population in Australia and New Zealand been affected by these challenges?
Oh, this is definitely a tough one. For me, I've been working with COVID face-to-face since it began over 1.5 years ago. And we don't yet understand the complete aftermath of this pandemic. Interestingly, there was a study done after the second lockdown here in Australia. It had over 13,000 participants that were surveyed. It found that 59% of people were more irritable than usual. We had 27% of people that had clinical signs of depression. We had 21% of people that had anxious feelings, and we had 14% of people that were more inclined to self-harm or not even want to be here.
Jackie, how about from your perspective? What have you noticed?
Look, from a leadership perspective, from leading a large doTERRA team, I wanted to expand a little bit more on loneliness and the aspect of loneliness and how it has affected us, not only here in this country, but also in the UK and in the USA. Now, in 2019, 1 in 4 Australians felt lonely. By the end of the pandemic, that stat was 1 in 2 Australians. 54% of us feel the effects of loneliness. There's 61% of the British population have increased that sense of loneliness, and 66% of the American population now feel the absolute effects of loneliness. Now, in Australia and New Zealand, I think we had some of the fastest acting lockdowns globally. 1 minute life was appearing normalish, if I can say that, during 2020. There was nothing much normal about it, but it was normalish. And within 24 hours, you were locked down if you were interstate, really too bad, too sad. And you were isolated completely and utterly from your communities. So our HPA access really is sensitive to those absolute stresses, the interpretation of threat. And so I think we've been under such influence of fear of the unknown, uncertainty, and that stress places a lot of physiological and behavioral and health responses and negative outcomes to us. Science links the loneliness in itself to multiple chronic health conditions, lung conditions, cardiovascular conditions, metabolic disorders, including obesity. And it is a major predictor of psychological problems, increased psychological distress, anxiety, and depression. So across the recent study done by Swinburne University here in Melbourne, those who reported feeling more lonely since the start of the pandemic also felt more depression. They felt more levels of high stress, more social anxiety, more avoidant coping strategies, more sleep-related issues, more headaches, more digestive issues, and more respiratory issues. So it's all there. We're feeling it within ourselves, but the research is really leaning into this as a major issue now and to come.
Isn't it interesting, Jackie? I noticed that you mentioned the interpretation of threats. It doesn't seem to matter to our physiology whether the threat is a real threat or whether the threat is a perceived threat. Our body responds exactly the same, doesn't it?
It does. It does.
It's pretty fascinating how the things that we feed ourselves, watching the news, watching Facebook messages, those sorts of things can heighten our system just as nearly getting into a car accident can, or having something dangerous happen to us with a wild animal. The system responds the same way. Isn't that interesting? Dr. Herzog, let's talk about loneliness for a minute. What can you tell us about loneliness and its effects?
So as Jackie was mentioning, there certainly are a lot of chronic illnesses that are going to be increased just because the stress on our system is going to be increased. All of us have had an increase of loneliness in this last year as events have been canceled. And certainly reports in America have showed that significant amounts of people are reporting more loneliness. So the interesting piece there is that with doTERRA, we have lots of awesome solutions. And so connectedness is something that we can cultivate by using our oils. So as you listen to this convention, as you listen to this discussion, I'd ask you to take out your favorite oil. Maybe that's balance, maybe that's adaptive. So if we want to connect more physically, maybe we're thinking of patchouli or balance. If we want to connect more mentally, maybe we're thinking about rosemary or cardamom or lemon. And if our goal is to connect more emotionally, maybe we're thinking about using marjoram, vetiver, cedarwood, or geranium. So think about how you want to connect during this convention. Use that oil here as we're talking today. And remember that the essential oils can help us to feel connected, so we can make a leap right away to reduce that loneliness.
That's great. Thank you, Jessica. What a great tool that we have within these oils, and thank you for that reminder that we can deal with some of these challenges with tools that we have right at our fingertips. I really appreciate that. Dr. Kay, we often hear about stress and burnout, particularly amongst healthcare providers, but also the population in general. What can you tell us about stress and burnout and the effect that has on our system?
Yeah, so one thing I'd like to do first is draw the distinction between stress and burnout. So a lot of times we associate stress with just this overwhelm with tasks that we need to get done, and that disparity between how we are able to handle it and what is actually going on in reality. Now, a chronic exposure to stress, continuous stressful events can lead to burnout. And burnout we see as more of a physical, mental, emotional withdrawal from everyday activities, the ability to take on your normal tasks, and you're just kind of shutting down, right, on a holistic level. Now, going back to stress, it's important to understand that stress is not so much a feeling, as people like to say, I feel stressed, but it's actually more of a process right, that our body goes through, a response to a perceived threat, as we've been talking about already. And also, as mentioned before, the threat can be real or imagined. The threat can be physical or mental. The threat can be an emotional threat. It does not necessarily have to be, a tiger is chasing after me. Your body, again, like we were talking about earlier, will respond the exact same way. So this is something I see as a root cause of a lot of health conditions that are coming into my practice, and a lot of confusion that people are having as to why, they're trying to do different things and it's not working, because we're not addressing the stress factor that's affecting all of us globally at this time, especially.
Yeah, thank you. It's in the literature for family medicine, we look at the statistics. It says 70%, and you and I were talking earlier, likely more of primary care visits are related to stress. And that when people are stressed, they're actually less likely to engage in the activities that will help them with that stress. They kind of give that up as the first things about, I'm too stressed, I don't have time to walk, or I'm too stressed, I don't have time to prepare a meal, I'm gonna go get fast food. And that, of course, compounds that challenge, doesn't it?
Absolutely.
Do you see that in your practice, Dr. K?
I definitely do. The 70% is quite accurate, actually.
Good.
And it's something that has been present for us before the pandemic, and now it has just simply been compounded to a debilitating effect that we're seeing on everyone. And diseases are exacerbated, symptoms are exacerbated, and these crippling nature of not being able to take care of daily tasks, like you mentioned, are just exacerbated right now with the pandemic.
That's a good point. Yeah, the 70% comes from data before the pandemic. That was 2015 data. I wonder what that would be from 2020 into 2021 now, with stress being related to visits. Interesting. Dr. Geiger, what happens to us physiologically when we experience stress? What is going on within our systems when we are experiencing this stress process, as Dr. K put it?
It is a process, and it can be very much multifactorial and very much multi-system influenced by those different factors. Everybody responds basically the same way in terms of a basic anatomy and physiology way, but everybody expresses it slightly different ways. As an anesthesiologist, I would try and hide it in the OR if I was being really stressed. And that just builds up all kinds of interesting feelings inside. As a father or a parent, it's a different thing. But as doctor, we look at patients, we look at people as what are the long-term effects. If you're into the chronic care of people, if you're into the acute care of people, it's slightly different as well. There can be really episodes of acute, almost like taking your foot on and off the gas pedal, on and off the gas pedal, where you're just repeatedly stressing your system. And it starts in the mind, and the different nodules in the brain, the different nuclei in the brain release chemicals which flow into the bloodstream and affect every cell in the body. So we need to step on the gas and change from this sympathetic response, this either really chronic sympathetic response, to a parasympathetic response. So instead of having peppermint all the time, maybe we should be, applying the brake and a little lavender. And I really like this ability of doTERRA to have this sharing time where we can share. As long haulers in this, we want to get through this as best as possible. And Dr. Herzog, your comments about different oils for different symptoms that we feel, different things that come up as humans, that's very, very valid. And doTERRA offers us a huge armamentarium to choose from, all these different oils from all over the planet. And it's truly remarkable what we're able to accomplish by sharing and relieving ourselves of the burden as we share oils with each other.
Yeah. Amy, tell us about what your approach is to stress and your understanding of the physiology that changes that happen to us.
Yeah, I suppose just like Catherine and Dr. Geiger were talking about, it's these chronic stress points. We know that stress can be a good thing, right? We know that we use that with athletes. We call it eustress in medical terms. But the issue is I like to describe it to my patients like a rubber band. You know, when you pull a rubber band, it recoils back. It goes back to a resting state. But if you're constantly pulling on a rubber band, eventually it just gets lax. And that's what in medical terms we call allostatic load. And it's basically just this wear and tear on the body, just this constant stress that never stops. And we know that that's associated with diabetes, hypertension, cardiovascular disease, obesity, chronic inflammation, which essentially underpins every single disease that we know of. So for me, it's like looking at essential oils, it's seeing all these, free radical properties, antioxidant properties that they have, and then knowing that from a cognitive perspective, that can help improve our memory and our judgment and our language and our emotions. And so, from a mental health perspective, these oils just have such a low side effect profile, and they work so quickly that in this current climate, they're just so needed.
Yeah. Absolutely. I think that it really does help us weather the storm, so to speak, when we have these tools that are at our fingertips to use. It's interesting. We had a discussion not too long ago in our medical advisory board about something called adrenal fatigue, and a lot of what we're discussing here has some inroads into that, where the system is so constantly stressed. And to your point, Dr. Carmichael, with that constant stretching of that rubber band, eventually it says, I can't give anymore. And so we start to get some symptoms that are significantly challenging for our bodies. So let's talk for a minute about how we might recognize where we are having some symptoms that are consistent with that chronic stress. We've been stretched too much. So what do you see in your practice, in your experience, when people show up that you're recognizing, look, we're dealing with some chronic stress issues? What do you look for? What do you see?
The irritability, cold hands, fatigue, poor sleep, poor concentration. There are some basic things immediately, and then that kind of leads on to people then having issues with potentially their blood sugars getting higher, issues with then starting to put on more weight, then starting to have issues with their actual day-to-day mood. So not just feeling stressed and overwhelmed, but every single day then starting to affect their job or their relationships or their career. I noticed that a lot of people tend to head specifically into issues with eating habits. That's probably the first thing that I noticed, and it's been a big thing that I've noticed with my clients here in Australia, is that once we start to have this almost like negative feeling, and I go into talking about like locus of control. A locus of control is that you have either think internally or externally. So you either internally have a choice, or externally you think things just happen to you. And we know that evidence shows that people that think externally that things just happen to them, they actually have poorer negative outcomes. And those people that internally know that they can change things, they have choice, have more positive outcomes. And so that's like a starting point for me. But I usually find that when people have that external thoughts, which is very common, their first thing to happen is they just lose all self-care. So they have poor eating habits, like Netflix has gone up, like Uber Eats has gone up, and then they start piling on the weight, and then it just has this kind of ripple effect onto every other part of their body.
Yeah. That's true, right? The eating habits, what I see in my practice, like two things actually, is that often what happens when people come in with chronic stress, they're reaching immediately for processed carbohydrates, like the feel good, quick rush. I just need to get through the day. And so we'll start examining eating habits, recognizing, and they sometimes even logically know, if I were to be eating different things, I would feel better, but I've just got to get through today. And so they reach for those things. The other thing that I've noticed too, and this is not to be discriminatory, but often men will come in describing symptoms of chronic stress, right? I'm more irritable, I'm, tired, I'm whatever. Women will come in and describe emotions of chronic stress. I'm feeling badly. They're much more in tune with what their emotional state is, whereas men have a little bit more of a difficult time accessing those emotions and even getting them out and being able to describe them. Once we're able to talk about them in a clinical setting, it gives them almost permission to open up and say, yeah, I really do feel that way, Dr. Riggs. I really am having some of these challenges. And now all of a sudden you're getting into a little bit more of an emotional conversation, whereas you amazing women often come in, have already identified it, and are speaking very immediately towards what you're feeling. It's quite fascinating for me.
Well, we do know that men present much later than women, particularly, and that's why we know that men have higher suicide rates than women as well, because usually things are, bottled up and enclosed, and then come out at a specific time, and no one ever knew about it. So we know that's the same with presentations in diabetes and cardiovascular disease. My father's a perfect example. You have chest pain, and then they just blow it off. But the woman's always like, no, you've got to go to the GP. And so studies do show that women are usually the ones that will trigger their partners to actually go and consult a health professional.
Yeah, this may be why married men live longer.
Yes, maybe.
It also may explain why married women live shorter. We cause a little bit of stress in you amazing women.
Talk from a wellness consult and a wellness advocate point of view. Dr. Amy, thank you for bringing up Netflix and Uber Eats, because often when we are training from a wellness advocate perspective, are new consultants in the art of the wellness consult, and we can go into it because of our training and our understanding, and that can be daunting for the new advocate. But to add to that list, has your Uber Eats account been overmaxed recently?
Yeah, I don't believe that anyone is immune to this. I think that this is, we all are in the same position. None of us have more superpower over anyone else, and it's about self-control. And I certainly struggle sometimes with my self-control, but I also am an internal locus person. So I know that when I need to change things, I know I have the choice and the ability to do it.
Yeah.
Absolutely. And Netflix going up, they're really easy conversations advocates can have, and it frames it well for them of increasing stress and where to look for solutions without boils. So that was amazing. Aha. Thank you.
Great. That's great. So we've described the challenge of mental health and mental wellness fairly well here. So thank you for broadening our understanding about this. So now we need to talk about, what can we do about this? We recognize there's a problem. We recognize there's challenge in all of our lives. This isn't just people that are suffering maybe from depression or suffering from anxiety. This is us. This is our families. This is our friends that are dealing with these things. So are there things that we can do to change the effect on our health? What lifestyle changes have you seen to be helpful? Dr. Carmichael, are there some things that we can implement from a mindfulness standpoint that can help?
Yeah, definitely. So like I said, for me, my specialty is stress and burnout. And so the starting point with every single one of my clients is like, take a pause, take a break. Because if you can remove yourself from situations and scenarios in that environment, that literally will allow you to have some inner reflection. And so, mindfulness is about being present, paying attention. It's about accepting and acknowledging where you're at with no judgment, right? And it's a space between the stimulus and the response. It's the pause between that. And so some people talk about mindfulness and meditation, but meditation is more of a practice about concentrating on one thing. So when I did my yoga teacher training, you know, we focused on just a flame, on a candle flame, or you can just sit and look at potentially a mandala or something. So there's a bit of a difference between mindfulness and meditation, but there is an incredible amount of research on both mindfulness and meditation. Particularly, there was a study done that showed after just 8 weeks of doing mindfulness, so that's just paying attention to being present, it found that we increased our left prefrontal cortex, which helped with our planning and our happiness. We also increased our grey matter in our hippocampus, which helped our learning and our memory. And then we also reduced our grey matter in our amygdala, so that helped reduce our stress. And then when you look overall, I've looked and there's over like 136 randomized controlled studies on mindfulness in health, right? And these are, you know, throughout the world in different countries, over 11,000 participants. And we found that there was improving in academic performance, there was improvement in sleep, improvement in immunity. We reduced that cortisol level, which we know is so important in our HPA axis. We actually reduced our response to pain. So there's been some great studies with people, you know, maybe Dr. Greiger can talk about this, but great studies with people pre-surgery and post-op surgery. There's specifically some great studies in reducing our loneliness in adults when we're mindful. And we also increase our compassion for others, which right now is just something that we all need to have. So for me, using these oils in a mindfulness or a meditative practice, that anchors in that feeling, because as we know, when we use our oils straight to our limbic system and immediately can change our emotion. So if I know that I'm like in an argument, you know, telling my partner off about the dishes, and I can feel I'm mindful and I'm like, okay, I realize right now I'm actually really frustrated, and I can go and grab one of those oils like ylang-ylang, and I can just then go and inhale it. That's a pause. It can anchor me in that moment to just pause before I go and react to my partner. So yeah, let's take a break and pause.
That's great. I love that. I love that. One of my first experiences with meditation and mindfulness was actually at a doTERRA convention. And many of you probably know Elena Brower, and she was leading the convention through an experience. And I was trying to be mindful of myself, but what I noticed in this convention of 30,000 plus people is the energy in the room changed from before she took the stage to after we took the stage. And it's not like we were excited before and unexcited afterwards. It's just that everyone was so much more grounded and centered afterward, and you could feel the energy in the room significantly change. And I turned to my wife and I said, I have to start studying this. I have to learn this. And have made it a practice of my own since that time, trying to learn how to do this and how to be more present in my life, my relationships, you know, my job here at doTERRA. And it has been life-changing for me to learn some of those techniques that you teach your patients. It's amazing. Dr. Herzog, I know that you counsel your patients about the importance of eating well. We've had several conversations about that and have been focused on that for some time now. What can we learn about eating well and preventing the effects of stress and maintaining good mental health?
That's a good one. So I would say let's remember the doTERRA Wellness Pyramid. At the base or at the foundation of that pyramid, we have eating right. So that, I would say, is hopefully an organic, whole food diet that's rich in phytonutrients. So those are your colorful, plant-based antioxidants, because that is going to provide the best nutrition that our brains need to weather the stress. We should try to keep out the things that are going to not serve us. So that would be processed foods that often contain artificial colors, flavors, white sugar, and white flour, because these have really little to no nutritional benefits, and they can definitely make our moods worse. And that's because anxiety and depression are well known to be chronic inflammatory type conditions. So for many of us, our inflammatory tendency is going to start in the gut. And so for a lot of us, that's going to mean starting with food. Around 75% of the immune system is in and around our digestive tracts. So this is kind of one way to describe how the immune system can be affected by food. Another way to think about this is the gut-brain connection, or the gut-brain axis. So it's another way to describe that the nerves that influence our digestive tract, like the vagus nerve, has a two-way connection. So our digestive tract can affect our mood, and our mood can certainly affect our digestive tract. So this system is a system of nerves and neurotransmitters and some hormones. And this is maybe one good point for PB Assist, why the good bacteria can actually affect our moods in a positive way, because we're helping that gut-brain connection to be stronger. As we're thinking about this pyramid, I might just also say that the next tier up here is exercise. I know we're kind of on this lifestyle kick. So I'll share a short story with you. I was blessed to have baby number 5 just 2 months ago, and I'm over 40. I'm working full time, and I'm probably the queen of burning the candle at both ends. But I exercise 3 to 4 days a week for an hour, right up until my due date. And that was the best thing I could have done. It was the easiest pregnancy I had. And I continued to eat my plant-based anti-inflammatory diet, which I've come to love, but it made a huge difference. I felt better. I recovered faster. So the easiest pregnancy at over 40 is quite the feat there. But there's lots of research that also shows that exercise can be just as helpful as antidepressant medication. So that is huge. I mean, I would say there's almost no substitute for exercise, and you can start wherever you feel comfortable. If it's walking to the mailbox to start out with, that's great. If it's going to the gym, that's great too. So wherever you can make that start, that would be awesome. The exercise is going to help those endorphins, and that's going to give us the more beneficial mood and the motivation to make some of these other changes. Because remember, our motivation neurotransmitter is actually dopamine. So when we're having a low mood, it's often that dopamine is going to be low also, meaning we're going to have a low motivation to making some of these awesome changes. So I might suggest, start a challenge week or a challenge month with your family or with your friend group, within your doTERRA communities. You start together, start connected, so we can do the change.
That's awesome. Thank you, Jessica. I appreciate that. It's amazing how, as we look at the research, and we've all been trained in pharmaceuticals, it's amazing when you look at the research that is non-pharmaceutical based, how effective some of these lifestyle changes can be compared to the things that we were trained in. And finding that we can have alternatives to taking a medication if we're willing to put in the effort and make those changes. Become something different. You and I were talking recently about my experience. I was doing some hiking just south of here in Zion National Park, and I was doing a hike called Angel's Landing, which is about a 2,000-foot elevation gain from the canyon floor. And as I was coming down, I had in front of me this lovely family, a 2-year-old in a backpack. Dad was carrying the 2-year-old, and then the mom who was next to them hiking, and when they stopped and turned, she was very, very pregnant. And this was not an easy hike. And so I'm not a shy person. I began chatting with them as we were hiking down and began having a discussion. And she was over 8 months along and was doing one of those hikes. And I mentioned to her how impressed I was that this was obviously not her being 8 months pregnant and getting off the couch for the first time and doing this hike. She exercised every day, as you indicated. And she says her OB thought that was just fine. She was completely safe to be doing that. And sometimes we use some excuses that we would commonly say, well, I can't do that because. And I think if you were doing it, Jessica, and this young lady that was doing this hike was doing it, I really don't have any excuse not to do something like getting up and moving a little bit more. So, Jackie, I was so impressed when we were meeting with each other for the first time, how much you have served those in your community with children who have their own special challenges? Is there something that we can learn from giving of ourselves to others that might help us in dealing with some of these mental health challenges?
Absolutely, and I don't think I can talk about sharing and giving of self and caring without quoting Emily Wright. So success isn't measured by how much money you make. Success is rather measured by how many lives you change. So thank you, Emily. My motto throughout my nursing career and my oil business to date has always been, if I feel a little bit wobbly or in doubt, I go and sort it out. So I find opportunity to instill happiness, insert inspiration, insert motivation, just insert care around my community. And I know that makes me feel good. And I know that flow-on effect makes someone else feel great and feel hopeful. So what I would like you to do right now is grab your favorite oil, everyone. I've got my Alpha Vitae. It is the oil of divine grace. And I'm all about grace. And it is an oil of abundant flow. I'm just going to do a little exercise. Just take the lid off. I want you to either drop it in the palm of your hands and breathe it in, or just close your eyes and breathe into the aroma. Okay, eyes closed. I want you to take 3 big, deep, rhythmic lower belly breaths. Really breathe in to that aroma, how it makes you feel. Keep your eyes closed, and I want you to feel into this statement. Hey, I was just thinking about you. How are you? And I was thinking how I would love to serve you today. How can I help you? Just feel that statement. And then I want you to think about your favorite healing hands story. And I want you to know and feel your small contribution to that, whether it's buying a co-impact sourcing oil, or whether it's buying a hope oil or a rose lotion. And just that small part you are making, knowing that that small ripple effect is creating part of a profound chain of events that will change communities' lives. Open your eyes. How does that make you feel? Is there a little smile in the corner of your mouth? Are you feeling different, feeling inspired? Are you feeling good about those statements and those feelings? I'm sure you are. What's happening here, there's a couple of things. We have the effect of the aroma, okay? We know the aroma through the olfactory neural pathways affect our limbic system and affect our emotions and uplift our mood. And we also have the memory here, the memory of serving, the memory of how it makes us feel great, and that ripple effect of how it makes someone else feel. And that is really good for our souls. That increases our sense of well-being, our mental health. So we know through MRI technology that giving stimulates our mesolimbic pathways, and it activates our reward center of our brain. It helps us and makes us feel good. And that evidence through giving and helping others has a direct benefit on our mental health, and it decreases stress by improving our mood, our self-esteem, and our happiness. So that is amazing. By us helping regulate someone else's emotional state, it has a direct effect on us regulating our own emotional state and our neuroendocrinology. And it improves, again, depression states and scores, and improves our emotional well-being. Also, volunteering and helping others increases our sense of community, our sense of worth, but also directly decreases our feeling of loneliness. And we know how impactful loneliness has been for all of us in the last 12 months. So the most simple activity in our doTERRA business and what our culture is based on is sharing, is opening those oils and inviting someone in to that experience of the aroma. And firstly, we get them to smell that oil and that experience of changing their mood. So just by you sharing and being in your community and doing the basic cultural doTERRA experience, you are uplifting your own state of mental health, awareness, cognition, and feel good, but you are also on giving back to others. And if we expand that again into the next part of our business practice, which is our sharing of those incredible, uplifting aha stories into our community, those feel goods into our team pages, we are profoundly changing, again, our own mental health and our happiness, our esteem, but also providing hope for others. And some in our community who lost hope in the last 12 months. And hope is something that we can hold on to, even when we have lost confidence. So that's really important. I want to just talk a little bit about gratitude if I can. So we have the science of serving, but we also have the science around gratitude and receiving and care. And there's some really incredible studies on cardiac patients, actually, that when they feel more grateful, it actually reduces inflammation, increases their mood and their hopefulness for the future. And also cardiac bypass patients, if they are engaged in an activity of gratitude, keeping a gratitude journal, that it also lowers their depression scores, increases their feelings of hope, and incredibly reduces inflammation. So just simple gratitude, care for self and for others. And I love when I'm sharing my aroma, touch, and my balance. I am such an advocate of doTERRA's blends. They are so clever. And if you look at the individual oils in these blends, you will understand why I love them so much for sharing. And as you listen to us talk more specifically about these oils, you will understand really the power of those blends.
Oh, thank you, Jackie. That's amazing. Isn't it amazing that to care for ourselves, we really have to care for others? And that is caring for us. I think that's amazing. The other thing that I have as a takeaway from what you just said is that as we're experiencing things mentally, stress, perceived threats, whatever it is, and it makes physiologic changes to us, the opposite can also be true. As we change this, our body, in accordance, changes its own physiology to where we are able to heal ourselves from many of the challenges that may be presented to us. It's quite fascinating when we look at that and recognize if we reframe things in our head, we change physiology. Amazing. Thank you. So let's just kind of talk as a group here. Are there other lifestyle changes that could be made to help us? We've talked about gratitude. We've talked about service. We've talked about some things, diet, gut-brain axis. Are there other things that we could be doing from a lifestyle perspective that could be helpful for us with these challenges?
I would like to talk about sleep, if I could, incorporating that. Before I dive into that, I just wanted to express how much I'm loving this conversation. Especially, thank you so much, Jackie, for what you shared. That is extremely powerful for everything that we're going through, that we do not necessarily have classes on, curriculum on in medical training, but we see the impact is growing now, especially through the study of epigenetics and what the lifestyle is doing to health conditions. And I'm just like trying to contain my excitement over here. And within the lifestyle conversation, continuing that, I just want to highlight sleep because I feel like that is one pillar of the lifestyle that's often swept under the rug. And I think that is because we have convinced ourselves as a society of this "I'll sleep when I'm dead" notion, that not sleeping actually somehow equates to more productivity. And that's a myth that I would like to bust right now and expose, because we are still, as adults, like particularly between the age of 24 and 64, are still projected to be hitting 7 to 9 hours of sleep every night. And we are falling short of that massively. And this also adds to the fact that those hours have to be good quality hours. So we need to make sure that we are ascending through the phases of the sleep cycle appropriately and sitting in each phase with the amount of time that we are supposed to rest in that phase, so that we can have a cumulative effect of good quality, substantial sleep, and not just hitting hours. Right. And so hitting the hours and having good quality hours has actually been linked to better sugar control, reduction in cortisol, better blood pressure management, and cardiovascular rebound. We see an elevation in cognitive functioning when you're able to ascend through all of the sleep cycles appropriately. And we even see a reduction in what I call stress eating, comfort eating, or those food-seeking behaviors that tend to rise when we feel that overwhelm, the pressure from the stress in our environment. And so this is a direct link between sleep and actually enhancing your stress management overall. And then if you're still struggling to hit the 7 to 9 hours, keep going. Just keep going. And that's fine if you're not hitting it right now. You still owe yourself the difference in rest, right? So you want to be able to draw that distinction between sleeping and resting. If you're just kind of like, I got 6 hours of sleep, you still owe yourself a couple hours of rest in that 24-hour period, to understand that it allows your body the ability to debrief from that day, from all of your stressors that you've accumulated in that 24-hour period. It allows you to let your body know that you're okay, and that the perceived threat, whether real or imagined, is gone. And so all of your physiological symptoms can start to go back to normal and pull your body back into homeostasis. Right. And that's what resting allows you to do. It allows you to be with yourself, to sit with yourself. And as Dr. Amy beautifully highlighted, with mindfulness, it allows you to sort through your emotions, but then not make it mean anything. Right. You're not good, bad, right, wrong. It just is what it is. And now you're able to respond and live that powerful life where you do have choice, as Dr. Amy said as well. So sleep, I think, is highly important. For some reason, I don't know, it's not as popular in the lifestyle, but highly important, highly important.
Sometimes that sleep is almost trained out of us, particularly as medical professionals, other professionals as well, where we are almost trained to go without it, to do what we have to do, which is probably one of the worst things that you could ask a healthcare professional to do. We're asked to make some decisions that require a lot of cognitive ability. And if we're not getting sleep, we're not at the top of our game. The other thing that I notice about sleep is that it's often worn as a badge of honor. Oh, I can do this in 4 hours of sleep. I go to sleep at 1 a.m. and I get up at 5 or 6, and it's almost as like, look how busy I am. I only get this amount of sleep. And that's probably not, it's definitely not healthy for us, is it?
Definitely not. And we have to change that narrative. And I know we were kind of, conditioned into that as early on as even college or high school even now. But it's not good. Even in specific phases, we convert short-term memory to long-term memory. So pulling an all-nighter before an exam is actually very crippling to the task that you're trying to achieve by gathering more hours to cram more data. And then we just carry it from school into our professional life. You know, I have all of these deadlines. I'm going to just stay up just a few more hours to get it in. But this is very detrimental on an immediate level, but then long term, with all of the physiological processes that are not able to function as optimally.
One of the things that I've become fascinated with over the last several years is a concept that comes out of Japan, actually. It was first identified in 1982 by the director of Japanese Forestry Agency. And it was really kind of a method to attract people to visit forests, where they did some studies and learned some of the health benefits of what they call Shinrin-yoku, or we would call it forest bathing here in the US, similar to sunbathing, being outside and getting some sun on our bodies. This would be similar to that concept of being in the forest and being amongst the trees. The reported research associate the healing components of Shinrin-yoku specifically on a few things. Number one, immune function. What we find is when we spend time in the forest and in nature, there are certain subsets of cells within our immune system called natural killer cells, and those increase significantly when we're spending time in the forest. Those cells are really responsible largely for finding and killing cancer cells that are growing within our systems. Number two, it helps our cardiovascular system. It reduces blood pressure. It helps with coronary artery disease. It decreases our pulse and our respiration, which leads me to number three, which is the respiratory system. Actually, spending time in the forest decreases allergies, and your response to stimulus can help with respiratory diseases. And you would think, if I have a respiratory disease, what do I want to do being out in nature? But the research seems to indicate we were created in nature, we were created with nature around us, and nature can heal us from some of these things. Number four, which specifically has to do with what we're discussing today, is we see significant decrease in depression and anxiety and other mood disorders when we're spending time in nature. And number five and number six are mental relaxation, particularly looking at maybe people with challenges like ADHD, attention deficit, or hyperactivity disorder. And then, and I love this because it speaks to what you were talking about, Jackie, our human feelings of awe, being in awe of something, which increases our gratitude and our selflessness towards others. Those benefits that we can get from being in green spaces, being in nature, are incredibly beneficial for our systems. Our systems seem to resonate with the earth and the things that come from it in a way that we are now able to prove scientifically. We probably all knew this intuitively, but now to see science catch up to say, when you go outside, when you're amongst the trees, when you're in the forest, your body responds in amazing ways to change and to help us become more healthy. And as they looked at what was causing this, they took samples of the air in the forest, and they found something called phytoncides, PHYTO, NCIDES, phytoncides, which are chemicals that are produced by the trees that go into the air, that our system, we breathe it in. So this is an aromatic application. And as we breathe those things in, it changes our physiology. Some of the most common phytoncides are alpha and beta pinene, which maybe we're a little familiar with, and we can talk about here in just a minute. But I just wanted to mention this concept of Shinrin-yoku, or forest bathing, because we resonate with nature. We are created in nature, and therefore we should partake of nature whenever we can. So many of us are now working and living in cities, but ideally we can find time and schedule time to be out within nature, parks, other green spaces, or we live here in Utah along the beautiful Wasatch Front. Head to the mountains, Be outside and enjoy that. Tad, what other things can you think of from a lifestyle component for dealing with some of these mental health challenges?
Well, I would have to echo loudly what you just said about nature and sleep, and that it is a factor that is important for all ages. These things apply to all age groups. Throughout life, we're always benefiting from good sleep. I mean, as an anesthesiologist, with a daytime job and a nighttime job, it's been really difficult at times. But on the other hand, I get really envious of the people who are in front of me sound asleep during surgery. And, it's awkward in that regard. But then I can go outside, I can go home, get a good night's sleep the following day. It works that way to replenish and restore. And that the idea where I said that, you can have too much stepping on the gas and you need to step on the brake in life. And Jackie, what you did with that moment for us, that was an electrifying moment of great peace and calm within the body system. And I felt it remarkably. And so as we go about all these different things that we've discussed, it's so important to realize that we need care for ourselves in order to be good caregivers for others. All the people that are around us that we can support and offer our help to, our advice to. This group here, we do that for each other in remarkable ways as we get together and have our conferences. But on the other hand, the average person who doesn't have all this medical knowledge, it's not necessary to have medical knowledge to enjoy nature. We don't need an fMRI or a blood test in order to benefit from this. And we certainly don't think we needed them to prove that it works, because we've been outside. We've seen how intelligent plants are, the oils that they produce, how intelligent they are, and how they interact within our body systems. Every single system can have an encounter with a plant through an oil. And I'm really excited about this company, doTERRA, and how they go about that. The literature that I've studied from around the world has changed a lot in this century from the last century. And I find it very fascinating that other countries around the world are so actively involved in producing really good research. But with the advent of the environmental threat time that we're in, a lot of the clinical research has disintegrated. I don't see it in the literature anymore, but it's more of the reviews that are summarizing the good research of this century. And it substantiates so much of what I feel when I go out in nature or after I've had a good night's sleep. I don't need a blood test to prove that to me. I just want to have my oils with me.
Right. Yeah. Isn't that amazing? Again, science is catching up to what we already know, right? We're able to prove that out. Let's talk about exercise for a minute. We haven't discussed much of that. Let's talk about, are there ways that exercise helps support a good mental health or well-being? What are our thoughts with that?
Definitely. I would say at the very least, we're supporting our own endorphin systems, which help us to combat stress.
Mm-hmm. Mm-hmm.
Yeah. We know that 1 in 10 premature deaths can be prevented from just exercise. And exercise, it's still an independent factor. So even if you're slim, if you're not exercising, you're still not getting those benefits. So basically, it's an independent factor, regardless of whether you're slim or overweight. You still need to be able to exercise and able to basically entrain our systems, help reduce our inflammation, improve our HPA access. And we know that particularly in mental health, has significant effects on lowering depression and anxiety. As much as counseling does, it has the same effect.
Yeah. It's amazing how we can help our physiology with movement, and not just in mental health. The beauty of exercise, as well as some of these other things that we're talking about, is that yes, we're talking currently today about mental well-being, but when you think about all of the other things that are impacted by exercise, by sleep, by a whole foods diet, it is amazing that we don't really wave this in the medical profession as our flag, saying this is really what you need to be doing. And if there are some significant things that come along, we can help with those things. But it goes back to our doTERRA wellness pyramid, right? Like, let's focus on the really large bottom part of the pyramid where you can impact it yourself without the need for us. And we'll take care of the very little top where you do need a little bit of extra help. We should be the champions of exercise, a good diet, a good sleep, being in nature, right? Reducing our stress, serving others, and doing those things.
Personally, for me, during the lockdown, we were allowed to exercise outside for 1 hour. And so I used to book they would be our walk and talk therapy calls. So I would call my best buddy who lived in Melbourne, who was in a more severe lockdown than I was. And we would set aside that hour, and it was most days. And she would get her coffee, I would take my sippy cup and my tea. We would consciously walk in nature, in the trees, and so we were getting the full benefits of exercise, the full benefits of nature, and that connection. And that really, personally for me, just kept me on point and my cup full during that time.
It's amazing.
It's also really interesting because, as health professionals, in actual fact, if we as health professionals, and if you here are watching this and you have people that you know that are in the health professional industry, then if they are actually doing these daily habits, if they are actually doing good eating, exercising, meditating, getting out in nature, then these health professionals will then counsel their clients or their patients on it. And we know that when health professionals counsel patients on it, then patients are more likely to do it when they know that the doctor is congruent and in alignment. So right now, if you ever felt scared of reaching out to health professionals, do not, because if you just got one health professional in your team, that would have a huge ripple effect because of the amount of people that they would be able to actually pass down these amazingly good habits, including using the oils for their emotions.
Yeah. One of the things that we've done here at our clinic in Pleasant Grove is if we'll ask our patients, do you have anything that you would like to talk about today of a sensitive nature, or do we need to do a sensitive exam today? If the answer is no, I'll often offer them, can we do this appointment walking? And we'll leave the office and walk around the building as we discuss their particular health challenges to do two things. Number one, it helps me get out from behind my desk and out of my chair for a little while. But number two, it does exactly what you were talking about, Amy. It helps us set an example to say, I too need this. I too am willing to do this. And so let's do this together, because I really don't think that the parental role of a physician or a nurse is the way that we should deliver care anymore. We should deliver care as we are just along the path with you. We're fellow travelers on this journey, and let me show you what I've been doing, and perhaps it will be helpful for you also. So I love that concept. We should be doing that far more often of walking the talk that we do in our offices, right? For sure.
No, I appreciate the conversation about bringing transparency back into medicine, because I feel like that's something we've lost. And I think another thing that we've lost is hope. And I feel that this conversation and bringing in the lifestyle piece to patients, to clients, wellness advocates, to ourselves actually helps to instill hope in one's own treatment journey, as you said, Dr. Riggs. And it actually helps to bring the ball more in the patient's court. Now you actually have the power to impact what you're going through this thing called lifestyle and all of these compartments that it's made of, and you are not having to rely on a drug or a person to necessarily tell you what to do like a puppet. You are empowered now to make choices on your own based on these very real everyday decisions. What do I pick off of the menu? Do I work out or not? Can I get another hour of sleep? It's very real, it's very practical, but it's easier. to deal with without having a medical license per se.
Mm-hmm.
It's very much appreciated. Yeah.
One of the things that I personally love about essential oils is we have taught our kids about the oils, and many of the oils are sitting on a coffee table in our living room, and they know what oil they can use for any particular situation. And they, initially they would come to us, I'm dealing with this, and what do I do? Now they go get what they need, and we've empowered our children to take care of themselves rather than depend upon us. As parents, I always want to empower my children to be independent, to think for themselves, to take care of themselves rather than to depend upon everyone else to do that for them. So it's one of those beautiful things. It's a small thing, but it doesn't go unnoticed by me and my wife, by my wife and I. Our children are learning to take care of themselves at a very young age. It's fun.
And I think that translates then into adults, right? Because if we as adults, let's say you go and see a counselor or a psychologist or a doctor, someone that you feel like you can confide in, even a friend, in that moment you're feeling like you can empty all those thoughts and frustrations and have someone to talk to. But there are many times that we don't have someone next to us, many times. And so when you're at home and you don't have that person, then the oils are your best friend. They're literally, like, the way I describe oils to people around me is I literally say, hey, this is Rosemary. This is like my best friend. She has a personality, and this is her personality. Because I can carry my best friends around me wherever I go. If I'm in the car in a traffic jam and I'm getting irritated and my partner's not there to calm me down, I can just pick up my peppermint, right? Like, I can pick up things right there and then, and that's the difference of having a provider or having a tool.
Right. Yeah. That's great.
I forgot my friends about 2 days ago in a very sweaty, hot swim carnival environment, high stress, watching a child swim. And I simply left my friends at home. And it was interesting to observe how my body reacted to not having those friends.
Isn't that great? Before we move on to oils, I want to just talk real briefly about something that you mentioned, Jessica, which is that gut-brain axis. We talked a little bit about diet, whole foods, less processed, organic, those sorts of things. But are there some supplements that we could take to help support that gut-brain axis? Absolutely.
So digestive enzymes would be helpful if you're having, the more stress we have, the less stomach acid we have, the less digestive enzymes that we're going to make naturally. So to have some support with that with a supplement can be very helpful. And then just making sure we have enough probiotics. That's the probiotics in our gut help to send those healthy messages upstream through the vagus nerve to our brains. So that's an amazing piece there.
Yeah.
I think a lot of people sometimes don't quite understand probiotics. They think sometimes that you take a probiotic and it colonizes your gut microflora, and that's not necessarily true, right? So probiotics are there to basically help modulate and share genes and actually support your microbes, and then they directly influence the immune cells and the epithelial cells that are actually in your gut. So it's not that they're putting necessarily like seeds necessarily into the gut, it's actually that they're utilizing the functions of that probiotic. So probiotics, like every single day, are so important, and there's particular ones called Bifidobacterium longum that have lots of studies about improving mental health.
Mm-hmm. Yeah, absolutely. I was reading a study recently that talked about fast food, particularly as we go to restaurants in our busy lifestyle, and how fast food meals, how quickly they impact the gut flora. They see changes within 4 hours of eating a fast food meal and a shift to the flora of the gut. And so if you're doing that 2, 3 times, 4 times a week, imagine how how much of a challenge you're creating for yourself in helping to support a healthy mood, a response to stressors, etc., when your gut microbiome is just not as healthy as it could be. It's really interesting.
It affects your whole immune system, right? As Dr. Herzog said, 75% of it is in our immune system. Our enteric nervous system affects that. So, right now, during all of these times, we need to have a really strong, resilient immune system, which is going to start in your gut.
Yeah, that's true. So essential oils have research in supporting mood. How specifically can they be used? And I'll just turn that over to the group as a whole. How would you use essential oils specifically to help support a healthy mood?
All day, every day. That's how I would start.
You go.
Inhalation is a really powerful aspect of anesthesiology, and that's what initially got me interested in oil physiology, oil chemistry, and the effects on the body. Because I'm used to administering something inhalationally to a patient and seeing the effects on the body, and I thought to myself, can this really be true from what an essential oil can do? Because I'd never heard of them. I mean, that's not something that I learned in the last century in medical school. It was new to me in this century. And I have such a passion for it now because I've seen the results in my life, my family, people around me, my own parents. I introduced them to it. So inhalation is a very powerful way of having the oils around you continually as a vapor. And that vapor technique is very, very powerful. We mustn't underestimate it, even though it's very, very simple to just put a drop of oil on a cotton ball. That I thought, when I initially heard that, I thought that could be pretty ridiculous to me. But on the other hand, when we just did this episode with Jackie and we just smelled it from our hand, that's no different than having a cotton ball in your hand. And much of the research that's been done in the hospitals, in ICUs, on critically ill patients has been done as an inhalation technique. Mm-hmm. And that research is very significant in terms of its safety in critically ill patients. So if we have safety in critical ill patients, how about in the average healthy patient? Or the average patient, the average person, the average child, the average geriatric person, all ages. An adage which I have come to employ in my life is that, where there are oils, there is hope. And I really think that we need hope in this day and time. Hope and inhalation of essential oils. In any given room, during the course of the day, the scent can be changed, the effect can be changed, and these effects can be managed and known, and expected results can occur that are scientifically proven and of great benefit to all of our body, and especially those around us as we act better because we have been influenced by the goodness of the oils. And I'd like to give a shout out to all you caregivers out there who need that shout out to say that we support you in your work, because you make a difference in people's lives, and we're thankful for you.
Yeah, absolutely. So Tad mentions an aromatic use of essential oils to support a healthy mood. What other ways might we use essential oils?
So we can use them topically. There's some great studies helping relieve some aches and particularly rheumatic pains. So I've seen that a lot in clients and patients, and also particularly in sleep. So, as we talked earlier, Catherine was talking about, if we can start with our sleep and if we can get that going, then we're going to have extremely good regulation of our normal hormones and be able to take on our day feeling empowered. So particularly in sleep, I've seen it support it really well.
Yeah. Perfect. So we've got aromatic, we've got topical massage. One of the things that we've done with our children at the end of the day before bed is we will have them grab an oil, and as they're getting ready for bed and laying in bed, we'll connect with them and asking about their day, asking how they're feeling. Recently, we've adopted a practice of gratitude. What 3 things are you grateful for? And we'll massage oil into their back or into their legs so that we get a physical connection with our children before they drift off to sleep. And I'll tell you, that's become a beautiful ritual in our home with our children. It really has helped us weather this storm over the last year much better than maybe we would have had we not adopted some of these techniques. What other way might we use essential oils?
I would say internally.
Okay.
Internal ingestion. I know in my household, our lineup of supplements includes a lot of doTERRA's encapsulated oils. Mm-hmm. So Adaptive, On Guard. These have been very, very, very instrumental for us and our lifestyles. And what I will say is I do notice a significant difference between an average multivitamin and taking On Guard per se every day throughout the flu season. Noticeable difference down to my 4-year-old.
So I'd like to go around the panel and ask you just what are the 2 or 3 products from doTERRA that you would recommend to support good mental health? So Tad, Dr. Geiger, let's start with you.
Okay. The subject of mental health is highly inflammatory from the standpoint of the diseases that are associated with it and how we can talk about them here. But it's also a process that can be difficult as we age. The mental health of aging can be really challenging. And I really like copaiba or copaiba, depending on which half of the world you're from. That resin from a tree from the Amazon is extremely powerful. It touches every organ system in the body. And the literature that it speaks to it is truly remarkable from different parts of the world, especially in the last few years. And I've studied them and offered them to the board here to study together. And we've been really impressed with this product, copaiba. And I really benefit myself physically from the soft gels. I find that the soft gels are very easy to ingest. And I know that in my body, there's enterochromatin cells in my intestines, which can actually smell the oil. And they pick it up, and they have it like a secondary effect within me. And I also was in a car accident recently, which was not my fault, and I suffered from it physically and mentally because I thought maybe it would end my career and end me physically to being able to be productive in that regard. And that was a real mental anguish for me. And also I had a lot of discomfort in my body, uneasiness, that just needed to be dealt with. And copaiba has that great power to ease your mind and ease your body simultaneously. And I've found that to be very, very helpful for me personally. I recommend it highly.
That's great. That's great. Dr. K, let's go with you. Your top 2 or 3 products that you would use to support mental wellness.
Mental wellness. So as I mentioned before, stress is a process or a response, not so much a feeling. But when we talk about feelings, one of the most popular ones that I have and those who I serve have is anxiety, right? So this, panicked, flight of emotions, flight of thoughts, heart racing, and people are just like, can you stop this panic attack for me? Can you stop this? I don't know what's going on. So I tend to gravitate more towards the oils that impact that directly. So more of the oils that impact the GABAergic system, which is our more inhibitory system that helps to bring balance into the more excitatory state of our cells that we tend to be in more commonly, or more prevalently, I should say. So bergamot for me is one that really helps to work on that GABAergic system with releasing GABA, calming you down, soothing your feelings, having those anxious thoughts really start to dwindle away. Because I think that lavender oftentimes gets the rap as the only calm you down oil, but bergamot is actually extremely powerful for this reason. I also like to sometimes couple that with rosemary for similar reasons, reducing the anxious feelings and helping to control that cortisol release that happens when we are dealing with that stressful response. And sometimes I will cut it with a citrus oil, like a wild orange, just to kind of bring some like invigoration, right? To kind of energize me, lift my mood, so I'm not just completely, even keel and relaxed. It kind of is a pick me up a little bit. So those would be my three.
Oh, that's great. That's great. Jackie, let's go with you next. Top 2 or 3 that you just love. That's who you reach for.
Well, we have a massive story that I'll share shortly about lavender and frankincense. So clinically in health retreats, when patients first come in, the first couple of days we are needing to relax, we're needing to switch off. And I've seen lavender do some remarkable things in promoting best sleep practices, promoting that pre-stress response, and bringing us into a state of almost meditation awareness. So we are calm but cognitively aware. I love that lavender works so well with rosemary and works great for being able to focus your attention and concentration. So pre-exam, pre-test time, pre-talking on camera, mixing rosemary with lavender. And I would also add my citruses there as well, because citruses are just happy. They're the happiness oils. They are sunshine, and we all need some of that in our lives, and that work very, very specifically with regards to uplifting our mood and stabilizing that. And Frankie is the next one. Frankie and lavender, I'll share a little bit more about that. But as you shared, Dr. Riggs, about nature walking and the chemical compounds in the forest, if we look at the chemistry of frankincense, it provides us with that richness of the alpha pinene. And so having frankincense just simply in a drop of your skincare of the morning provides you with that walk in the forest, provides you with those feelings of greater well-being and mood stabilization. So that would be my 2. And then I think lifelong vitality, again, a personal story. We know it works so beautifully with increasing cognitive awareness, function, brain power, it lifts mood, and it provides that base foundation in nutrients and phytonutrients that we need, helps with our gut-brain access. So they would be my absolute 3 without a doubt.
Perfect, thank you. And Dr. Herzog, I know you're a huge fan, a huge proponent of Lifelong Vitality Pack as well. Other things that you would add to your list?
I think when we're talking about mood support, we have to talk about adaptive. Just as the name implies, adapt, it allows us to adapt to the stress around us. So there's kind of 2 sets of oils there. Lavender, magnolia, and neroli are all pretty common with having more linalool. So they're going to be more calming for us. You might put sweet gum in that calming realm as well. And then it has the wild orange and the spearmint, which are uplifting. So depending upon which end of the mood spectrum you might be on, you might need some calming or might need some uplifting, or maybe you need both at the same time. It's going to be able to have that effect for you. And just like Dr. Geiger was mentioning with the adaptive has great nervous system and body effects. So it has adaptive in there as well. I'm known to carry it in my purse all the time. So if the kids are a little bit too loud in the car, I have a go-to, or it's on my desk at work. So, if a deep breath is not enough, I have something else there to support me to to release those feelings. And, all of us in healthcare, we might, take on the stresses of the folks that we speak with during the day. So to take the break, take some deep breaths, take a drink of water, kind of de-stress on our break time is a huge thing.
Yeah, it's interesting as you mentioned that. Years ago, probably 6 or 7 years ago, I was discussing with a colleague that exact thing, that sometimes as we're dealing with challenging patients, and sometimes we do take on that energy as healthcare providers. I was asking the question, how do I not take that energy home to my family? How do I leave work at work and not have it disrupt my home life? And I was quite surprised from this friend of mine who is an OBGYN who said, you know what you ought to look at is essential oils. You should think about using frankincense and kind of calming those emotions and resetting your energy so that when you come, I was like, what? And so she recommended get some frankincense oil, put a couple of drops in your hand, breathe deeply as you're getting into the car to go home, and just don't turn on the radio, don't talk to someone on the phone. Just let that time and the frankincense kind of seep into the system. And by the time you get home, I promise you, you'll come home without dragging any of that negative energy with you. And it's been true. It's been a practice of mine for years since that time. And she didn't know at the time that I was quite interested in essential oils. And so it was interesting to hear from another medical colleague to use frankincense to do that. It's fascinating. Dr. Carmichael, tell us about your top 2 or 3 that you would recommend in this setting.
Yeah, so I seem to attract a lot of A+ personalities, perfectionists that tend to be quite on the go, and then head towards that anxious feelings, pretty much similar to me. And so for me, my number 1 is Roman chamomile. It's just, if you came to my house, you will see my stock is of Roman chamomile. Like if anything ever happens to doTERRA, I have my stock of Roman chamomile. So, and the reason I love that is because it soothes the spirit. It allows us to reconnect emotionally. And then scientifically, it's a calmative, it's a sedative, it's anti-inflammatory. There's been some great studies on its antispasmodic effects. So particularly at that time of the month for women, it's great to rub over the abdomen. It's incredible in children. It's a very gentle oil. I've been used a lot in GI disturbances, which we already discussed earlier about the gut-brain connection. So, if you have any of those GI disturbances, this is my number 1 oil that I go to. And then on top of that, it helps improve our HPA axis and our sleep. So for me, it's a calming, relaxing oil. It's my number 1 oil that I love. But I also love ylang-ylang because I think we were talking about citrus oils bringing joy, but ylang-ylang is kind of like this inner child. And for me, when I think of it, I do think about me going back to being like 8 years old and trying to see life with that kind of in awe, in that kind of rose-tinted glasses effect. And so that's what ylang-ylang does to me. It calms me emotionally, but it also physiologically, there's some great studies on how it can reduce heart rate and improve our alpha brain waves, which is what we were discussing earlier about mindfulness and meditation. We have different brain waves, and one of them in particular, when you're in that meditative state, goes towards that alpha wave. So for me, it's ylang-ylang and Roman chamomile, 100%.
Beautiful. Thank you. So thank you for sharing with us your top 2 or 3 things that you would use to support a good mental health. And I appreciate that. I'll tell you, for me, speaking about forest bathing or Shinrin-yoku, it's those oils that bring me back to the forest. I have behind me my diffuser running in my office. It often has those evergreen or conifer oils in it because of that alpha pinene, beta pinene. While I can't access the forest all the time, I can bring the forest into my office. And we see some of those same health benefits through the research. That as we look at the research, it indicates that if you can't go to the forest, you can bring the forest to you and see some of those same great, powerful effects. And so for me, it's the conifer oils, frankincense, black spruce, Siberian fir, those sorts of oils that really speak to my soul of being in the trees. The other thing that I'll mention that maybe wasn't covered here is the use of lavender internally. There's lots of research out there out of Europe indicating that when we're having some mood challenges, using lavender oil internally, not only aromatically, can be extremely beneficial for us. And that those research articles were one of the things that really convinced me that we have great power in the chemistry of essential oils. So that being said, I want to end on this question, and this is more of a personal question. As medical professionals, we have an immense amount of training. Most of that amount of training is in disease process, physiology, pathology, and pharmaceuticals. So why is it that we have this amazing panel of medical providers that are speaking on behalf of doTERRA today? What is your story that brought you here? And I'd like to start first with Nurse Jackie. So Jackie, can you share your story as to why you're here?
Okay, I had used clinically essential oils for over 20 years in the health retreat industry, and really they weren't my friends in my handbag. And then we had some challenges with high anxiousness in one of our children at night, and then waking up feeling very, very uncomfortable and a level of stress. So we were really at our wits' end. And I started hearing about doTERRA, and I thought, you know what? Let's just try it. We have nothing else to lose. And it was frankincense and lavender that I chose that night when my kid came from the States, because when I started with doTERRA, we didn't have a lot here in Australia. And I just took the lids off and I smelt them. And after so many years of working with the oils, I could immediately smell the potency and the purity without even having to use them. And I felt something within myself. So that night, I gave our child a beautiful back massage, and that night he expressed very, very clearly his worries and concerns. So he felt so much more relaxed and safe with those oils. That night he had the deepest, most restful and rejuvenating sleep he had had in years and years. And that morning he woke up with no feelings of anxiousness. So to be able to go off to school feeling imbalanced rather than high stress was remarkable for him. He could take in the inputs of the day. He could read his room well, and he could feel settled and okay within himself. So that was incredible. Within 48 hours, we had a different child. Being a nurse trained in not sleeping, being an on-call nurse in a health retreat, connected to a pager 24/7, regardless of whether I was on duty or not, I didn't sleep well at all. By the application topically of massaging those two beautiful oils on my son, I started waking up feeling refreshed for the first time ever as well. So I knew at that point there was something remarkable here. I then took those two oils plus balance and lavender peace into the health retreats. And what I saw there was, without a doubt, something I had never seen in my clinical nursing career. The accountant loved me because within 2 weeks we had reduced the naturopathic supplementation spend dramatically. And the naturopaths weren't particularly liking me because I wasn't selling their supplements. I was just happily handing out diluted drops of oils. And I saw physiologically, these oils up against the reactions to detoxing, both from our emotions and our physical and our environmental environment. So I was sold. And that's my story. And I'm here today, still passionately in love with what these drops do.
Thank you, Jackie. We appreciate that. And now we know how to get an accountant to love you. That's good. Okay. Dr. Amy, can you share with us your story of why you're with doTERRA?
Yeah, sure. I mean, I came to doTERRA initially because I was just a very sociable person, actually. If I'm really honest, it was about being a great cook being a great cook and a host. So I got introduced via a chocolate making workshop. But what happened in that moment was that I then took those oils and I didn't do anything with them until I met my partner, and he used the oils as friends. And he said to me, "You really need to research this." And I, being stressed and burnt out and overwhelmed, I was like, "Oh, I don't have time." But when I actually sat down and geeked out, which is what I love to do, and looked at all of the studies, for me it was like, okay, I have to pick the best company that has these essential oils. It was just a no-brainer. And so when I looked at like the purification, the CPTG, when I looked at that there was a medical board, that was just like tick, tick, tick immediately. It was just a no-brainer for me. And I think then following that, when I made them my best friends, I had this incredible experience when I did my yoga teacher training with frankincense, and just really having that calmness, that unification of my mind that comes with frankincense. And it's just, ever since then, they're always around me.
Wonderful. Wonderful. Thank you. I love how you guys speak about your oils as your friends. I think that's great. And what a variety of friends we have with doTERRA. Dr. K, tell us about your experience with your conversion, I guess, to essential oils.
That's funny you say it in that way, because I actually don't feel that I had a conversion. I feel that it was something that was always there, simply because of my upbringing. So I'm Nigerian, and I grew up in a very traditional West African household where nature was strongly integrated. And every time I go home to Africa, I'm immediately reminded of our innate connection to nature as humans, like as a collective, right? We have this strong urging to want to be entangled with nature at all time, which is why what we're going through right now is extremely debilitating of having to be disconnected. But I feel that when I'm in those moments, I'm reminded of things that here in the United States or in Western civilization, we have to have double-blind studies and things to prove what we know to have been with us from the beginning of time. Things that I know work for myself and for my family culturally from generation after generation after generation. Things I've pulled from trees and eaten as a child that were used just to balance my body, that we now have to be very politically correct in how we're sharing that knowledge with the rest of the world. So doTERRA was kind of my way of bringing nature back to myself within a civilization that has been created to kind of carve it out, right? And so for me, doTERRA, essential oils have always been there for me, but doTERRA essential oils, that conversion for me was about the integrity. For me, integrity is everything. And if I'm going to say that something reminds me of nature or mimics nature or is incorporating nature, I need for the integrity to be aligned with nature. And doTERRA was able to demonstrate that for me. If I can't get out to collect the sap myself, or I get a doTERRA frankincense bottle, I feel secure in the fact that it was harvested correctly from a soil level that was grown correctly, so that that plant had its most like a fighting chance to produce the best form of oil in the first place, to then be collected and not adulterated, and then have the highest standard of testing to deliver it to my front door to remind me of what I know and what I've experienced growing up. So for me, it was a seamless choice or a seamless transition and an obvious choice to go with doTERRA because of their integrity.
Thank you. I appreciate that. Dr. Geiger, how about you? And then Dr. Herzog. Why are you with doTERRA?
Very well. It's a very simple story in some regards. I have always had this analytical basic science and advanced sciences mind. And when I started to see the culture of doTERRA and the science of doTERRA combined, I was thinking, my, how different that is than what I'm used to. What else did they do? And I gravitated immediately to several specific oils which helped me in my own health. And I started finding out that there were great results involved. And now I look at the research involved in the things that I benefited from personally, and around the world that I see these great articles that doTERRA has produced. And I'm seeing the new science, and the thrill is back in store for me, back in the store, because before it was all, science and the feeling and the improvement personally. And now I see that this is a global phenomenon where doTERRA is producing from laboratories great science on their own products. And that really just impresses me beyond compare, to see the reality of their own products being tested and seeing results in fields which I have been so fascinated by, the omic fields, genomics, epigenomics, proteomics, metabolomics. All these different fields in the human body have just fascinated me. And doTERRA is bringing that to the forefront as one and only industry that is doing something from an anesthesia viewpoint, which I think is critical. And that's the scientific study of the kinetics of oils. So that's a follow through for me. From the very get-go, I just see it building and building and building. And what the body does to the oil and what the oils do to the body is medical, but it's also very, very personal to me. And I'm so glad doTERRA has that culture which combines science and humanism to the max. I love it.
Thank you, Dr. Geiger. I appreciate that. Dr. Herzog.
So about 8 or 9 years ago, I was seeing some of the pitfalls of Western medicine, starting to look into integrative and functional medicine. And along that same time frame, a dear friend of mine said, I had something right up your alley, meaning I like natural things, and it was natural. So she provided me with a few essential oils, and I have to admit I was really busy, and I didn't get around to looking at them. And then a couple of weeks later, I found myself 3,000 miles away from my family. I was at a medical convention, and my husband calls me and he says that the baby, the third one at that time, had a fever. It was the first time I'm away from home and the first time he's had a fever. And I knew exactly what to do. I called my friend and I said, you need to tell my husband how to use what you dropped off at my house. And she was gracious, and she did. And the baby did great. My husband's nerves were calmed. And I learned a lot when I got home. She filled me in on all the details. And kind of a neat follow-up to this is, as I incorporated them into my practice almost immediately, they became a daily use in our home. And I found myself a few months later in Utah. And I tracked down who Dr. Hill was, and I tracked down his secretary, and I said, I have to meet him. I have to talk to him. I'm all in. And he tells this story, and it's a little embarrassing, but I really said, I'm all in. I will do whatever you want me to do. I see the power in this. This is nature. This is working. And I've been, doTERRA has been my friend. The oils have been my friend ever since. And I'm so humbled to be here.
Oh, thank you, Jessica. Thank you. One of the beauties of doTERRA is that not only do we have amazing oils that we can use to help people, we get to develop amazing relationships. It's been so fun to be with each of you on this panel. I would just close by saying my own story has lots of twists and turns to it and some specifics, but I will say, and I've said this before, one of the reasons that I am at doTERRA is because I found my people. I found my tribe at doTERRA. And what I mean by that is in medical school, we had a class of about 100 students, and each of those students, I really believe, had at their heart, they were there because they wanted to learn how to help people, how to serve humanity in a specific way. And it was exciting to go to 4 years of medical school and then do residency with those sorts of people. And then years later, as I get introduced to doTERRA, and I get introduced to a culture of people that want to take care of each other. That is the beauty of doTERRA. And Jackie, you said it earlier, that it's not about how much money you make. It's not about the prestige that you have. It's how do you impact others' lives? How do you best take care of humanity? And doTERRA as a culture is all about that. That's why I am at doTERRA, and that's why I stay at doTERRA, is because there are thousands and millions of people out there that at their heart want to take care of their family, their friends, their neighbors. And that to me is a beautiful thing. So thank you all for your participation in our panel today. We very much appreciate it. I'm sure we'll be seeing more of each other as time goes on. We're grateful for our audience, your attention today, and we hope to be seeing you all real soon. Stay healthy, stay safe. We'll see you soon. Bye-bye.